So we're talking to Sharon Sholzberg-Gray, who is a leading expert on healthcare in Canada. Sharon, what do you see the next things we need to be doing, the next steps?
Well, we've been talking about the next steps probably for about 30 years now. I know I've been giving speeches and writing about it for that. And that is the Canada Health Act is a physician and hospital-oriented piece of legislation, which did that part very well. But we now have a chronic care world, and we have an acute care-based Canada Health Act. What we really need to do is find ways of bringing health care that is accessible to everyone in an equitable way across this country. And that means home and community care, access to long-term care, access to pharmaceuticals in the community by pharmacare. So that's the unfinished business of healthcare, and that's something that needs to be addressed. And everyone knows about it, and everyone's been talking about it, and that's one of the reasons for our extra high costs for healthcare, because we tend to focus on the expensive parts and not on the parts that are cheaper. So those are the key missing elements. And the other thing, of course, is number one is invest in the determinants of health that keep people healthy so that we don't get unhealthy and need our health system. And that means education, housing, income inequality issues, and that kind of thing. But if we're looking at health itself, home, community care, long-term care, pharmacare, it goes without saying. We need to do it. We have to stop talking about it.
And is pharmacare a big one? Is it? I mean, people sort of think it's an almost impossible.
It's very big because it looks like a big chunk at the start. Monique Bégin today mentioned that 30% of our healthcare costs are borne by individuals or by private insurers, and that is the drug part in large measure, and by people paying for their own home care and their own long-term care, which has, in some cases, very, very high co-payments. So, but how to define what we need and how to do it in an efficient way is not easy. For instance, you wouldn't want to take the existing prescription habits of people in the health system today and say, okay, we're covering all of it, because some of them, these prescriptions are inappropriate prescriptions. So we have to deal with appropriate prescriptions, follow-up on drugs, drug utilization, and all those things. So it's not an easy topic. That's probably why we don't do it. But it doesn't mean we shouldn't do it. We need to do those things without question.
Okay, thank you very much, Sharon Sholzberg-Gray.
Yeah.